so jealous right now. Look at her. Yeah, you. You are ridiculous. Really cute. And then, can you spot baby? Tell me when you see her, tell me when you see her.
That sounds sweet!
Good morning! Hello! I've got my hair up in a... whatever, you don't care, do you? Oh my god, please don't do this. I look like a right leather. It is. Is that right? Hello. It is day 5. It's Friday. Looking back on it now, that's gone quickly. But my god, today has been such a struggle. My appointment's a later one today. It's at 1:45. Time now is 10 to 12, and my driver will be here at about 1:15, so I'm actually ready early. But today has been rough. Every day has been tough, but today has been rough. Like my impulsive thoughts and the not wanting to go, like my anxiety. I don't want to go, I can't do it, I don't want to go. Oh, there's never a choice of whether I'm going or not. I'm going, but I've been having to deal with fighting against that a lot this morning. So I had a really slow morning. I got sorted the babies, sat at my table for a bit, let my legs drop because my restless legs. Lovely. I even went back to bed for a bit, and then I've just got up, I've freshened up, and we're ready for another day. But I thought I'd just quickly check in before I go for my appointment, check in when I come back, and just give you a roundup of week 1, I guess, and then we'll go from there. Odds are no, we'll sort that out along the way, okay? So tired. Anyway, I'll see you in a bit. Bye. 3 days later, because I was absolutely fooked. Well, hello. Hello. Oh, hello. Why do I always go, like it's such an effort to be here? I'm the one that picked the camera up. Hello. Oh my god, I literally look like Sideshow Bob. I'm rather windswept. Today is... No, it's not Friday. Today is Monday. What's the time? It's 1:05. My appointment, I had an early one today. It was at 9:45. And then after my appointment, I had like a, I can't remember what it's called, but where you sit down with a nurse and you just discuss everything and how it affects you. You do that at the beginning of treatment, and then you do it at the end of treatment to see if there's been any changes. As well as weekly, you fill out the multiple questions, you know, the tick box where you can mark off to what degree you're, say, feeling anxious, or yeah, you know what I mean, don't you? And when they say it's an intense treatment, they're not kidding, because when you go in for the TMS, obviously that's the treatment in itself, but while you're there for 45 minutes around, you're chopsing away to the nurses. Oh god. Oh, hi sunshine. Hi sunshine. Oh my god, I actually look fucking nuts. I look rough. So yeah, you're literally chopsing away to the nurses, as you do, just like talking like you would to anybody, but then you have to bear in mind that they are documenting things that you say. Not that that's a bad thing, I'm just saying. It's all so intense. And then today I had that appointment, and I'm gonna have to get closer. Hi. Today I had an appointment with, it was the matron of the department. She's a specialist. We ended up chatting for an hour. It's supposed to be like a half an hour thing, but I was in there for an hour, and yeah, it's like therapy within itself, like daily talking to the nurses, and then today talking to the matron. Matron.
All nurses to the nurses station.
I can't say that without hearing that in my head, because matron sounds so like old school, don't it? I said, oh, I didn't think that they even still use that anymore. But yeah, it was very intense, in depth, and it's all about being as honest and open as you can be. I always am. I do have this automatic mask, but I'm also quite vulnerable when it comes... What's going on with this lighting? Oh my god.
I complicate things. One of my many skills.
But I'm also pretty good at being like vulnerable in these kind of situations, because you have to make the most of these opportunities. So and things were spoken about, and some things were mentioned that it's kind of validating, but kind of also like, oh my god, here we go again. But I'm not even going to go into that. We've decided just to put that on hold, just concentrate on the treatment, and then if we feel it's necessary, we'll pick that back up at the end of treatment and go from there. Anyway, last week's sessions, they were good. It's nowhere near as scary as I thought it would be. It's just literally like the tiniest taps on your head with obviously like these little shocks, but it's not as intense as you'd think. I started off at 40% last week, and then this week, today, they started at 45%, and then they'll increase it. I think it goes up to 60 maximum, but that doesn't have to go up to that. It's not one of them where the higher you go and the quicker that you go higher the better the treatment. It's all about your tolerance and where your sweet spot is. So we're just going to keep going with that, and if I feel uncomfortable, I'll just let them know and they'll bring it back down. Last week it was good. I was exhausted. I was going to my appointments, coming home. Here we go with the lighting again. Oh my god, I'm sweating. Sorry for all the moving around. I cannot cope with that light. It gives me a headache, and it's all I can concentrate on. Every day after the treatment, I was coming home and getting straight into bed, which is annoying because I'm so fatigued that I needed to get into bed. Like, I couldn't physically hold myself up, but when I lay down in bed, it hurts. So yeah, it's frustrating, but it's just one of them things. And by Friday at 7 p.m. I was falling asleep, which never happens. I think I had 2 naps in the week. I don't let myself rest. Friday I was falling asleep about 7, but I didn't let myself go to sleep. Can't remember what time I went to sleep, probably about 12, 1 o'clock in the end. Spent all weekend in bed, but I did do my cleaning and that on Saturday, just like a hoover round, a quick clean. On Sunday, in bed all day, and then believe it or not, I did wash my hair yesterday, Sunday as well. Yeah, then we're back to it this week, so not a lot to update really. I don't know whether I'm going to do these updates weekly. Do you want to see them weekly? You'll have to comment below to let me know. That rhymed, because it could get rather repetitive, but I will do a day in the life, oh my god, of rTMS, maybe the last week, or maybe next week. I'm gonna chat to the nurses a bit more, and then I will ask them if it's okay for me to film a little bit. Not necessarily with the nurses in it, or like don't mean the whole treatment. I just mean maybe them putting the cap on, or just a quick pan of the room, the setup, what it looks like, for those of you that are curious. So on that note, I'm gonna go because this light is driving me mad, and I have some editing to do. So if you've got any questions, just leave them in the comments below. I'll see you in my next video. That rhymed. Bye. I forgot to say, it's too early to tell if there's been any improvements or not. If I was to pinpoint anything, it would be like in the evenings when it's time for me to have my shower, because I set an alarm now at 8 p.m. and oh my god, my brain, so tired. And that's a normal side effect, by the way, feeling tired. But I feel tired all the time because of my fibro. Yeah, it's too early to tell, but so when my alarm goes, I know, you're thinking, just close the fucking curtains. I don't want to live in darkness all the time. And the cats are in and out of the window, so once I'm up and I'm in the shower, like normally when I'm having a shower, I'm like, I hate everything about it. I do things just to get them done. There's no like enjoyment in anything I do, but I'm going to throw this camera. I'm just jumping up, and rather than pottering around and going, oh, I'll do this just before I get in the shower, procrastinating getting in the shower basically, I'm getting up and I'm getting in the shower, getting all freshened up, which makes me feel better. So that's one thing, possibly, or it's just the fact that I'm obsessed with routine. Would anybody like to see my morning routine? You'll have to let me know. Anyway, on that note, I am folked.